Well, 3 Round Rock hospitals were at their ICU bed capacity this morning, but since then, they've added more beds as COVID-19 hospitalizations spike. So it shows the flexibility hospitals have to take in more patients, but there is a limit. As KXAN investigator Kevin Clark explains, it's not the number of beds leaders are worried about, but the doctors and the nurses to staff them.
Hospitals can adjust their number of beds according to need. They can move some of their ICU patients to recovery rooms, but staffing ratios are likely to be affected as a result. And that's where local officials become concerned.
So we're looking at surging, and where can we get some retired nurses from our community to come back to service for the good of the community, or bring in doctors or nurses from other cities.
For example, 3 hospitals, Seton Medical Center Round Rock, St. David's Round Rock, and Baylor Scott and White Round Rock all had no ICU beds left before adding more Friday. A post from Wilco Commissioner Terry Cook said these hospitals expect to need 23 more ICU beds in the next 10 to 14 days. This comes as the 3 large healthcare systems tell us their percentage of used ICU beds in our area jumped 10% in 1 week.
The cries of people at the ER because they weren't able to catch their breath was just traumatic.
Austin Mayor Steve Adler and others have pleaded with the community to stay home over the holiday weekend. He says this is one of the last moments for the community to determine whether our area will need a pop-up hospital in just a matter of weeks.
The alternate care facility at the convention center will be ready to take people soon after July 20th, 22nd. But whether or not we actually have to use it or not hasn't been determined yet.
Kevin Clark, KXAN Investigates.
And Mayor Adler said the 7-day average for people with COVID-19 in local ICU beds is about 60. He said there were 73 people in ICU last night. Well, there are more than 57,000 staffed hospital beds in Texas. Now, according to state data, nearly 12,000 beds are available. This means hospitals are about 79% full. There are 1,100 open intensive care unit beds now, and more than 7,600 people infected with COVID-19 make up those admitted at Texas hospitals.